citizens rally, and I got a call from this gentleman, and when I heard his story, I thought, absolutely, pal, you're the kind of person that makes this country great. I'm going to introduce him. He's a medical doctor, Dr. Timothy Floyd, and a little bit of background on Dr. Floyd. He's an orthopedic surgeon who was practicing medicine, and when 9/11 came, Dr. Floyd decided to take his practice to the U.S. Army, and he decided to join and go to Iraq and help serve our troops. And he worked in a medical base, serving our troops in our country, and he asked if he could say a few words, and I said, gosh, I mean, we can't not have you say a few words, so I'd like to introduce you, Dr. Timothy Floyd. I'm here today to talk to you about, can you hear me now? I'm here today to talk, okay. Shut up over there. I'm here today to tell you what most physicians believe the implications are about this behemoth new health care plan that we've got. First of all, nobody understands better than physicians that we need health care reform. But Congress ignored the will of the people when they passed this thing. The U.S. Constitution and the Bill of Rights comprise 6 pages. This thing is 2,407 unreadable pages. Said it will be of little avail to the people if the laws be so voluminous that they cannot be read, or so incoherent that they cannot be understood. And that's an accurate description of this bill. The big pitch on this thing was coverage of 32 million uninsured people, but we all know that that number was inflated. Many people who are eligible for Medicaid, for example, simply just haven't signed up. Many of the uncovered are between policies, others choose not to be covered, and many are ineligible because of their citizenship. In reality, about 3% of our population cannot get health insurance, and there are many ways to take care of these people other than with this bill. This bill will diminish the quality of health care of the remaining 290 Americans. American medicine leads the world. Medical advances have added decades onto our life expectancy. 85 of the last 100 Nobel Prizes in medicine were awarded to Americans. American medical centers work miracles around the clock. We can replace every joint in your body, and we can unclog an artery in your heart and have you back to work the next day. Foreign heads of state leave their own countries and come to the United States when they're really sick and need the best care. Just 2 months ago, the governor of Canada's Newfoundland province came to the United States for heart surgery. American medicine is so much better than other countries because of the freedoms that our founders built into our system of government. That foster unfettered discussion, creativity, and a protected entrepreneurial environment that breeds technological advancement. But the liberal progressives in power in Washington want to change all that. They view the socialized systems in Canada and Europe as superior to ours. Well, let me tell you how it was when I was in Scotland, where I spent 2 months as a medical student 28 years ago. Healthcare resources are restricted by the government through the National Institute for Clinical Excellence, or NICE for short. NICE. Their website says, use NICE guidance to help you cut costs. Operating rooms are restricted. Personnel are kept thin. They keep the hospital beds filled with relatively healthy patients to keep the sicker, more costly patients from being admitted. They deny life-saving measures to non-productive members in society. When I was there, it was forbidden to give kidney dialysis to a child under 6 years old or an adult over 60 years old. Wow. Now, we consider that immoral in this country, but there's one U.S. doctor who believes in these policies, and his name is Ezekiel Emanuel. His the President's Chief of Staff. And Zeke is the top health advisor to the president. You remember when the president said a while back that if your grandma breaks her hip, we might just want to give her a pain pill instead of surgery? Yeah. Well, that's where that policy came from.
What?
And that's how socialized medicine works in other countries. Healthcare resources are restricted and controlled by the government to save money. And this is the road that we're headed down. Rather than nationalizing charity, we should work to restore family and community values where we all come together and help those less fortunate than ourselves.